Anorexia means the loss of appetite and inability to eat, often due to a physical illness. Anorexia nervosa is when a person intentionally restricts their food intake. What is anorexia nervosa? A person with anorexia nervosa will intentionally restrict trusted source their food intake as a way to lose weight or avoid gaining weight. A person with anorexia nervosa will often have an intense fear of weight gain, even if they have severely low body weight. Dietary restrictions can lead to nutritional deficiencies, which can severely affect overall health and result in potentially life-threatening complications. The emotional and psychological challenges of anorexia nervosa can be hard for a person to overcome. Symptoms: a lack of nutrients may lead to other physical signs and symptoms, including 1. Severe loss of muscle mass. 2. Listlessness, fatigue, or exhaustion. 3. Low blood pressure. 4. Lightheadedness or dizziness. 5. Low body temperature with cold hands and feet or, possibly, hypothermia. 6. Bloated or upset stomach. 7. Dry skin. 8. Swollen hands and feet. 9. Hair loss. 10. Loss of menstruation or less frequent periods. 11. Infertility. 12. Insomnia. 13. Loss of bone density, increasing the risk of fractures. 14. Brittle nails. 15. Constipation. 16. Irregular or abnormal heart rhythms. 17. Lanugo, which is fine downy hair on the body. 18. Increased facial hair. 19. Bad breath and tooth decay in people who vomit frequently. Anorexia nervosa causes. Concerns about body weight and shape are often features of anorexia nervosa, but they may not be the main cause. Experts do not know exactly why the condition occurs, but genetic, environmental, biological, and other factors may play a role. For some people, anorexia nervosa also develops as a way of gaining control over an aspect of their life. As the person exerts control over their food intake, this feels like success, and so, the behavior continues. Anorexia nervosa risk factors. Several factors can increase a person's risk for developing anorexia nervosa, including 1. Past criticism about their eating habits, weight, or body shape. 2. A history of teasing or bullying, especially about weight or body shape. 3. A sense of pressure from society or their profession to be slim. 4. Low self-esteem. 5. Anxiety. 6. Having a personality that tends toward obsession or perfectionism. 7. Sexual abuse. 8. A history of dieting. 9. Pressure to fit in with cultural norms that are not their own. 10. Historical trauma, such as racism. Diagnosis. Early diagnosis and prompt treatment increase the chance of a good outcome. The doctor may ask the person questions to get an idea of their eating habits, weight, and overall mental and physical health. They may order tests to rule out other underlying medical conditions with similar signs and symptoms, such as malabsorption, cancer, and hormonal problems. In addition to a physical exam, this may include trusted source. 1. Blood tests, including coagulation tests, a complete blood count, and a comprehensive metabolic profile. 2. Urine tests. 3. An electrocardiogram. 4. Imaging tests, such as a computed tomography, CT, scan or bone density scan. A psychological evaluation is also necessary to determine if a person meets the diagnostic criteria for anorexia nervosa. Treatment and recovery. A healthcare professional will make a comprehensive plan to address the individual's specific needs. It will involve a team of specialists who can help the person overcome the physical, emotional, social, and psychological challenges that they face. Strategies include 1. Cognitive behavioral therapy, CBT, which can help the person find new ways of thinking, behaving, and managing stress. 2. Family and individual counseling, as appropriate. 3. Nutritional therapy, which provides information on how to use food to build and maintain health. 4. Medication to treat depression and anxiety. 5. Supplements to resolve nutritional deficiencies. 6. Hospital treatment, in some cases. Complications. Complications can affect every bodily system, and they can be severe. They include problems with 1. The cardiovascular system. 2. The blood, such as a low white or red blood cell count. 3. The digestive system. 4. The kidneys. 5. Hormonal imbalances. 6. Bone strength. Anorexia nervosa versus bulimia nervosa. Anorexia nervosa and bulimia nervosa are both eating disorders and sometimes share certain symptoms, such as an intense fear of gaining weight or a distorted body image. However, people with anorexia often restrict food intake, exercise excessively, or adopt extreme diet patterns to lose weight. On the other hand, bulimia nervosa is characterized by recurrent episodes of binge eating or eating large amounts of food, followed by compensatory behaviors to prevent weight gain, such as self-induced vomiting, excessive exercising, consuming laxatives, or fasting. If you know something extra about this, then comment below, because this will be helpful for us. At the end, it is requested to please subscribe our channel.